Okay, well, today I'm really excited to have Joanne Weltman from Smile Therapy for Kids on for our expert interview about Hypervibe. And I just really appreciate your investment of time, Joanne. So welcome.
Thank you so much. I'm so excited to be here.
My pleasure. So I'm curious, Joanne, if you don't mind, share a little bit about your business and what it is that you do at Smile Therapy for Kids.
Smile Therapy for Kids is a all-inclusive holistic therapy clinic for children with various needs, normally developing children to children with special needs. And we have all the services here. So we provide OT, physiotherapy or physical therapy, speech language pathology, we have RMI functional therapy, we have vision consultants. We bring in as many different people as we can to service all the needs of the children that we see.
Wow. So what is the typical age, or like when do you see children? Like from what age all the way to what age?
We start from birth, and the oldest children we have right now are about 15, 16.
Oh, wow. Mm-hmm.
Yeah.
That's fascinating. And so what are some of the main challenges or conditions that you typically see children for, based upon your experience and just what you're seeing with your business?
We see children with any diagnosis. Mm-hmm. So it could be neurological, things like cerebral palsy. We have different genetic conditions that we see, Down syndrome. We have spinal conditions. We also see normally developing children with orthopedic conditions as well. And we see children post-surgeries. And one of the big surgeries that we're seeing kids now undergo is the selective dorsal root rhizotomy, which is SDR. And that's normally with children with cerebral palsy.
Oh, wow. Wow, very interesting. So, and then you've been at this for how long? And why did you get
my goodness, I've been at this forever. I feel like a dinosaur. I've been, I think, close to 30 years now. Working in pediatrics, and I've been fortunate enough to pursue this career, not just in Toronto, Canada, but all over the world. So I started in South Africa, Johannesburg, San Diego, California, my favorite spot in the whole wide world, Auckland, New Zealand, but I've been in Toronto for 24 years now. So I've met so many people from around the world. I've worked with experts in every area there is, because that's one of our passions at Smile, is to reach out, consult, do courses with anyone and everyone who's got the knowledge to increase the level of care that we can provide to the children that we see. The more knowledge we have, the more we combine different approaches, the more we can help each child, because each child has a different sensory system, a different nervous system. They respond to different input, and to find the right combination for each child takes a lot of exploring and investigating and trying of different techniques.
Wow, that's fascinating. So I'm curious then, within physical therapy, you see so many different conditions that you treat, and I'm sure there's a number of different modalities and approaches that you utilize. How is it that you first heard about the whole body vibration and became aware of the benefits of whole body vibration?
So with whole body vibration, I came across it because I try and keep up with research as much as possible. So I'm constantly, if I'm in the car, I'm listening to podcasts on any kind of research. I listen to different experts giving talks and presentations. And I came across it through a combination of listening to the podcasts, dealing with research and other experts, and became quite curious about this vibration plate. So I actually got myself a very basic vibration plate, and that's how I started. But then soon learned that actually wasn't good enough, and we can go into that a little bit more.
Yeah, sounds great. So with that, I'm curious what, as you're doing this research and understanding the potentiality of the benefits for whole body vibration with different conditions. What stood out for you in terms of specific conditions and what it could help the body for? And again, in your case, with children's bodies.
So, what we started hearing more and more about vibration, especially with the kids that come back from having SDR, selective dorsal root rhizotomy, where they cut the sensory nerves in the spine to get rid of spasticity. And a lot of work was done with the vibration plates in St. Louis with Dr. Park. He's one of the first people that started to suggest that children start using this post-surgery. So that's when I got the basic vibration plate. We started to use it with a lot of the kids that came back. And then I started doing more and more research into the different vibration frequencies, the different machines, and how they actually worked. We started using it mostly with those children who had the surgery, and then found it very effective in a lot of our children with different conditions, whether it be neurological or orthopedic, and for different reasons. So the sensory information that they get from the machine itself affects all children.
Yeah.
And when you have the surgery, they cut the sensory nerves. Mm-hmm. So there's a loss of that sensory input that we know. We've got the sensory motor loop that needs to occur for the brain to, so the sensory comes in and the brain needs to react with the motor output. And that is missing. So one of the great things that the vibration plate does is it does give that very strong proprioceptive sensory information for these children to almost replace what is now missing. So for those children, we found it absolutely essential to be used post-surgery. But honestly, it's been life-changing for a lot of the other kids that we work with. Not just because of the sensory, but because of the strengthening, the stretching out of muscles, the relaxation, the normalization of tone. Many, many years ago, when I worked in neurodevelopmental therapy in South Africa, when we were working with stroke victims, we were taught by the Bobats to use vibration to normalize tone. So way back when I knew about vibration, but there's vibration that you can elicit as a therapist by handling, and then there's this level of vibration that the machine can give, which is totally, totally different. Another thing that we find a lot with our kids is that they suffer from osteopenia, osteoporosis, because they're not moving enough. They're not getting enough muscle contraction. Muscle contraction, we know, makes stronger bones. And we have kids who will roll over and fracture a bone. So the vibration in itself, we know, especially with all the studies with older people, it's one of the most important outcomes that you can get from this machine is that you can strengthen bones. Yeah. So we're getting a lot of different things happening with this vibration plate, not just strengthening. You get muscle relaxation, increasing bone density. This is something that helps a lot of the children that we work with.
Yeah, well, I appreciate that, and I know that you and I share a common belief and about how important movement is for children and adults. That and even going back to the original studies, and the reason why whole body vibration really came onto the scene was the research with astronauts that go into space. That when the body's not being exposed to pressure or gravity, in this case, that muscles start to atrophy, bones become less dense. And unfortunately, in our society today, so many people are not moving their bodies as much as they used to, multiple generations ago, because we have more of a sentient lifestyle where people are watching television, sitting in cars, adults certainly sitting in their work environments for extended periods of time, and the body's not moving, and therefore over time starts to gradually decay. And children specifically, oftentimes, yes, their bodies are not being exposed to movement, and therefore muscles and bones are not developing. So I'm sure, I think what I'm hearing from you is that experience of seeing, one, the research, as well as an actual application, that you're actually seeing benefits by having children be exposed to whole body vibration in controlled environments, so it's safe, but while also very stimulating.
Exactly. One of the recent studies that I was just looking at now was on children who have osteogenesis imperfecta, which is brittle bone disease.
Right.
And I actually thought it was a contraindication to put a child with OI onto a vibration machine. But the studies show that it's actually helping them
Yeah.
to improve their bone density. So if it can help those children, it can help anybody.
Yeah. That's fascinating. So I'm curious how you first found out about Hypervibe and what specifically stood out with Hypervibe, and the distinctions that you noticed between that and other platforms that you were.
Right. So actually, I've been able to compare it to a few platforms. So the very, very basic platforms that you get, that you can go onto Amazon, you can buy them from anywhere. Those basic platforms, sometimes they move side to side, sometimes up and down, but the frequency of vibration is only good enough to maybe do a little bit of balance retraining. That's it. You're not going to get much of a vibration that will move into tone reduction and strengthening. And I realized that very quickly when I did get the Hypervibe. The difference is incredible, and the results totally change. So that vibration, those vibration plates are great, but not good enough. So I started doing research because I needed to get something better for the children than the basic vibration plate. And I did. I looked into the comparison between the Hypervibe and the other vibration plate out there that is comparable. And there really is just the two of them, with the mechanics that allow you to get to that level of vibration to make those changes. And I did. I compared, I looked at the research, I spoke to experts, and I had to remember that this technology, it's great that kids come in for therapy and they can access the vibration plate, but I needed something that parents could get for home, something that was cost effective but worked. And if I was going to use that device and my parents were going to use that device, I wanted to make sure that I was giving them just as good a device to use at home, and not to buy something cheap that wasn't going to have the effect, because these children need that therapy every single day. And with COVID, we've realized with all the parents that we're working with, the changes that are made because the parents are actually working every single day with these kids is unbelievable. So yes, they need to have a really good machine. So I actually had both of the top side by side next to each other, and I compared them in the vibration. And I can say that the Hypervibe is more comfortable. It's smoother. It's less jerky, and the input is just more tolerable and easier to work with. That was one of the big things that I found with the Hypervibe. Cost, I mean, you cannot get better than the Hypervibe for what you're getting in the ability to afford it as a parent. It's doable. It's really, really doable. The other device is excellent as well. I'm not going to say it's not, but the cost is quite extreme.
Yeah. So, and one of the things I do love about the benefits of the Hypervibe is having that capacity to, one, have the pivotal platform, because as you know, our hips move independently of one another. So the linear platforms don't give that capacity for the hips to move independently. And then the other thing is the capacity to also go into the lower frequencies does, as you mentioned earlier, it can help with balance and proprioception. So you
Right.
do have benefits on the lower frequencies, and there's I liken it almost like I'm not a golfer, but on a golf course, you have different clubs for different ranges, and so in certain cases you may want to have that power, but in other cases you may want to also go a little bit slower and be able to work the balance. And so having that benefit of being able to do both with the Hypervibe is another great thing as well, that we see a lot of our people, just sharing and having benefits from. So I'm curious, with your experience working with Hypervibe and your clients and your patients, of what are some of your favorite stories or experiences that you've seen firsthand in terms of outcomes and benefits?
We've seen so many different improvements with the children. One of the major things that I've found, children have something called dystonia, so the children with cerebral palsy. And there is this almost the startle or the switch off that they get with movement, or if they're emotional. And the Hypervibe, I think it's more the sensory input almost seems to tone that down. That is one of the things I've seen with one of the children that we've seen that have had SDR. Now the spasticity is removed and they have this dystonia, and it's almost like they're trying to maintain their standing and their ability to stay up, but it's the lack of sensory and awareness causes them to startle. They have less feeling of where they are in space. So without the Hypervibe, they tend to startle a little bit too much, and they get the switch off in their muscles. With the Hypervibe and that sensory input, that constant input, and it's giving them a lot more information to where their joints are in space, they don't startle as much. They start to calm, settle, organize. The muscles get stronger. The proprioceptive information from their joints becomes stronger in itself as well, and they feel more confident in space and they don't startle. So that is something very different that a lot of people don't talk about when it comes to vibration. It's very unique. The other things we've seen and we know, because the children go for obviously the bone scans, and they found that their density has improved. They've had improvements in alignment, so scoliosis, that's improved. There's their muscle ranges have improved because you do a lot of stretching. And strength is, these kids are getting stronger in all areas of their body. So their posture is improving because they getting the proprioceptive input. And as you said, the side to side rocking motion that you have, that mimics gait, and it almost loosens up the joints as they're on the machine. All of this is impacting the child and their pelvis and their postures. We have children who don't sit on their own, but you put them on the Hypervibe and they start to learn to sit up by themselves because of the sensory information, because of the vibration that is increasing tone. All of that all together at once is making those changes, and these children are feeling what it's like to sit on their own. Then the brain is registering the sensation and what it feels like, and it's impacting their ability to sit on their own on the floor. Same with standing. We have some children who cannot push up against gravity in space because they're just not getting enough information from gravity, from the environment. You put them on the Hypervibe, and that extra information that you get, as you said, like the astronauts, it's giving you extra gravity, extra support. They can stand. Yeah. That support is given to them, and they can strengthen, they can stand, and they can hold the right combination of muscles. They can activate them all and coordinate that activation and learn what it feels like to maintain that position in space.
Yeah. Well, Yeah,
And then off the machine, it's the same thing. They start to put it all together.
yeah, it's that concept, I think, of neuromuscular re-education. Um,
Correct.
I've gone through that myself. I had an L5S1 microdissectomy, and my S1 nerve, which is the nerve that connects to the left calf, was very damaged. And for 9 months after surgery, I couldn't lift my heel off the ground on my own. And so the nerve wasn't connecting to the muscle. And so by using the Hypervibe for myself, even my surgeon said, Doug, you may never get the use of your calf back again. You just need to kind of be prepared for that. And I'm one of those people, like, that's a challenge. And I said, okay, game on. And how can I work with that? But so much of the different therapies I was doing for myself weren't working. And I know that using that and standing on my calf and doing the calf raises over and over again, it gradually came back over time. So it does do something to stimulate that. And when you're looking at the number of vibrations per second and the signals that's being sent to the brain, it's helping the brain either learn or relearn how to have that movement back again and stimulating those connections.
Right. And the opposite to that, we have our toe walkers who, number one, they need to stretch out their calf muscles, but they also need to learn where to stand in space, because they're used to, some of the toe walkers are more sensory based, and their settings in their brain is to be more forward. So their weight is through the ball of the foot. They're not used to staying back on their heel. So that sensory information that gives them where they should be standing is huge.
Yeah, absolutely. Wow.
One of the other things I want to mention, one of my passions, is the developing hip. So we have a lot of children with cerebral palsy and other conditions. It could, as I said before, many genetic conditions where they're not standing. Now, the hip is a joint that needs to form and grow with the child. As they're weight bearing, the acetabulum starts to cover the hip joint, the femur, the ball and socket. It needs to start to grow, and the angles need to change for a proper, secure joint to form. Now, these children are not standing. They're not getting that benefit of standing. Yes, they can stand in a stander, but with the Hypervibe, we're also stimulating that acetabulum to form, the bones to grow and form, and that joint to form correctly. So getting these kids onto the Hypervibe and getting them standing for periods during the day will help with that.
Wow, that's fascinating. I didn't even think of it that way. That's it makes complete sense, though.
Yep, and you need that. You need the pressure of the weight bearing for it to occur.
Yeah, absolutely. Yeah, I mean, even for ourselves, and I have a stand-up desk right now that I'm communicating from, and that was the first investment my surgeon told me to get after surgery. But just the number of hours that the average person and child is sitting, and sometimes it's because of a condition and they're not capable of it. But if that's happening, the bones aren't developing, the muscles aren't developing, and even for ourselves, I look at. For me, and even standing, if I'm not moving and I'm not getting that circulation of blood going through my system and I'm not activating my muscles, that's also not beneficial. So every few hours, I just make it a point to go stand on my Hypervibe for a couple minutes, and it activates also just the endorphins in my body and everything else. So it's almost like a nice cup of coffee or tea, and I don't have to have a stimulant. I actually get the natural stimulant just by getting on this, and then I get to come back to work and I have a more heightened sense of focus, and everything else has been activated as a result. So I'm sure that actually works for children, and especially for those that don't have the current capacities to be as physically active, and therefore they're not developing at the same rate that other children would be that would otherwise not have those conditions.
Yeah. So we find that it is very alerting as well, because there's a lot of sensory information that will wake up and alert the system. Another thing that we are quite curious about is the visual and the vestibular system, and how it's impacting our kids with that, because they really have to stabilize their horizon on this machine, because there's so much vibration. And the visual vestibular ocular system is one of the more important systems that needs to develop as well with the kids. And unfortunately, those kids who are not moving enough don't get that connection being made because they do not experience the variety of positions that they should. And when we work with the children on the hypervibe, we do. We change up the position. There's a lot of that sensory information. The vibration, you do have to stabilize when you're on the machine because of the vibration. Your vision needs to work a little bit harder to maintain where you are in space.
Yeah.
So there's so many different effects that this machine can bring to these kids.
Yeah, I appreciate that. And so it sounds like also you had mentioned that, for your business, especially in the COVID environments and people being at home much more frequently, having time with their children, that not just while they're in your office environment, but also kind of giving homework for parents to have their children on at home, but you can give that level of guidance to remotely consult your patients so they can actually continue to have that development and not have to come in if it's not as convenient, or even when they are coming in every few weeks or however often it might be to meet with you and your staff, that they can actually do things every single day at their home.
Right. And it's quite an easy tool to teach parents to use.
Yeah.
There are so many simple, easy exercises that they can do on the hypervibe, and the kids can gain so many benefits. For parents, handling sometimes can be difficult, facilitating and moving children. With the hypervibe, it's pretty easy to teach. It really is.
Yeah.
There's so many different ways and bits of equipment that we can add to the hypervibe to get different, to challenge the child in different ways. But it's still simple enough for the parents to use.
Well, what I love about this world that we're in today, even using our video conference software here that we're on, and we're able to have a conversation from San Diego to Toronto, and understanding that the way that our economy and our way of life is being changed forever after the results of what we've been going through here recently with the global pandemic, and understanding that that medical professionals such as yourself can work with and do remote consultations and have patients not just in your necessarily geographic area that are coming to your physical facility, but also through video conferencing, that you would even have the ability to have a client from their home with their child and coach them on the hypervibe and give them the exercises and activities and be able to observe their movements. And again, nothing, in my opinion, is equal to a physical in-person environment, but it's a very close second in terms of being able to still be able to give guidance to people and be able to work in a remote environment and ensuring that each one of your patients and clients and children are able to have the steps to continue moving forward in a positive way.
Yeah, it's actually advice or a tool that we use that actually provides quite an intensive intervention in the home. Mm-hmm. Compared to many of the other devices or tools that we can use with the parents. So not only are they getting an intervention, but they're getting a really strong intervention for their child that's going to make lots of good changes, and really easy to teach at home over telehealth. Really, really easy.
Well, and I was going to say with telehealth, it's great that you have that ability to be able to still, if your families have a hypervibe in their home, that you can work with them and really guide them. And then the beautiful benefit of it is too, with the hypervibe, for those parents that are looking for something for their child, if there are any potential challenges or conditions to overcome, that it's also the benefit for the parent too, which is great.
Exactly.
Yeah.
Exactly. We often get the parents to try the exercise, and we get lots of complaints from them because they realize how hard it is. Yeah. And you do need to work. And we have some parents who are using the hypervibe just with their kids and feeling great.
Yeah, that's amazing. Well, I really appreciate your investment time today. Is there anything else just top of mind or a message that you would want to share for anyone that may be watching this or discovering or learning more about your business or whole body vibration and hypervibe?
Obviously, we are a teaching facility as well. We love to share and teach and reach as many parents and therapists as we can. and are always open to questions. If people have got questions, just to email us and we'll get back to you as soon as possible. We often share different exercises and little snippets of ideas that we're coming up with. Every single day we come up with something new on the Hypervibe. The kids challenge us. So we come up with new things, and you can often see our snippets here and there on our Instagram page. That's mostly where we share information. And yeah, if people have got questions, we're happy to share and do more.
Yeah.
Just let us know.
Yeah, I appreciate it, Joanna. We will have the smiletherapyforkids.com site linked within this window here for people to be able to access. And please do visit your website. And I really appreciate your investment of time today, and just honor and appreciate the fact that you are working with young children that have conditions. There's such a need for that in our society. And I know beyond Hypervibe and whole body vibration, it's just this need that we have in our society for families and children to have access to different approaches and modalities to get their body moving and activated and stimulating the health and well-being that we all have access to on some level. It's just helping to support that process. So thank you so much for your time, and I look forward to...
I actually have one little thing I forgot to mention. Just remembered, from a physical therapy or physiotherapist point of view, that when you are using the Hypervibe or vibration tool, you can actually combine it with other therapies. It works with other therapies as well. So we've often combined it with things like Theratogs, Muscle Stim, and you're just getting extra bang for your buck. It's easy to combine it. It doesn't have to be used alone. So just remember that as a last little snippet of information, that it is multifunctional for many different uses.
Awesome. Well, thank you so much. And I definitely look forward to continuing the dialogue with you.
Good. Thanks so much.
My pleasure.